Now, Mark Brennae on CFAX 1070.
4:37 on your drive home. On Saturday, people with anemia and their families will gather for a patient education day in Vancouver. Our next guest has anemia. She finds it tough to walk sometimes to breathe as well. Our guest is Pam Wishart, who suffers from MDS, Myelodysplastic syndrome, or Myelodysplasia, which is a form of bone marrow failure. Pam Wishart is a board member of AAMAC, Aplastic Anemia and Myelodysplasia Association of Canada. Thanks for coming in, Pam.
Hi.
Hi. You have MDS. When did you first discover that you had this?
I was diagnosed in 2000 and could in fact have been diagnosed in 1997 just through a routine blood test. But in 2000 I was feeling tired, exhausted, went to the doctors because I knew something wasn't right.
Okay, so so it sounds to me like fatigue is one of the first sort of signs of this. Would that be accurate?
That would be accurate for probably most people with MDS because most frequently it's the red blood cells count that's low. However, it could be the platelets or it could be your white blood cells or any combination.
And in your particular case, you were feeling a little fatigued. You went to the doctor for what you thought was probably a routine checkup, and then you were given this news that you have MDS, a very long, difficult name to pronounce, and you're going, what is this?
Yes, and there wasn't much available out there. And through looking on the internet and an interest in medicine, and a degree in biochemistry, which helped me read the literature.
That's right, you have a degree in biochemistry.
Yeah.
Well, you're a leg up, at least understanding some of these terms.
I found out more and more about it, and then in 2003 I went to a patient education meeting in the States in San Francisco at the AAMDSIF, which is Aplastic Anemia Myelodysplasia International Foundation.
Easy for you to say.
Yeah, even though I didn't get it right that time.
Are there a lot of people in Canada, or let's say in North America, because you were down in San Fran, suffering from MDS?
In Canada, the numbers, I don't have an accurate number, but about 1,500 to 2,000 new cases of MDS a year.
Does it hit a particular age?
It does. Median age is early 70s. I was diagnosed at 56, which is considered young.
You're obviously younger.
Yeah.
Yes.
And so, in fact, I think it's going to be a more and more common diagnosis as the baby boomers age, because I'm pre-baby boomer. And as they get older, more people will be diagnosed with this form of bone marrow failure.
Okay. What can be done? I mean, the bone marrow, when you hear about bone marrow, you hear about, cancer, generally. This is not that.
It is. There is discussion about this.
That it might be related to cancer?
That it is a lot of experts consider it a cancer.
Yes.
Others do not. It's clonal in that you have a cell which has gone off basically on its own and sort of taken things over and produces cells which aren't right.
What do we know about how it's passed along? Is it genetic? Not genetic. What's the word I'm looking for? You know, when it's passed on from one...
Genetic.
Genetic.
Hereditary.
Yeah, hereditary is what I was trying to get at, yeah.
No, it's not. Though I personally suspect there may be a weakness, perhaps, which could be exacerbated by chemicals. Some chemicals are known to cause it, but there's no proof about anything. And remember, I'm a patient, not a physician or a researcher.
Did you have to change your diet or anything to avoid certain chemicals once you were diagnosed?
No.
And do you feel that there was something that you ingested or that led to you contracting, or I'm not sure, developing MDS?
I've worked around chemicals all my working life.
Do you think it's related?
I think it probably is, but there's no proof.
Right. So what's being done about this? How big is the medical community looking into MDS?
They're looking into it more and more because it tends to be a disease of older people. it was ignored more for a while. Certainly when I was diagnosed in 2000, there was very little information out there.
Yeah.
Now there's a lot more. And they look at mutations in your chromosomes, and they look at things called translocations, where a bit of one chromosome may have detached and become attached to another.
Yeah.
And there's one specific form, 5q minus, for which there is medication, which works pretty well. And now they're also looking at the gene level, so even lower down. And I think in the future, treatment will be at the gene level.
Gotcha.
At the moment, the only cure is a stem cell or bone marrow transplant.
Are you in line for one of those?
No, those tend to be pretty hazardous, and I have an additional problem in that I have an antibody which prevents me having transfusions. And somebody with my hemoglobin level at the moment, my red cell count at the moment, would normally have transfusions, but I can't, and I'm lucky I do function. But with transfusions, you have another problem, which is you build up iron, and then the iron has to be chelated. And this is not really, this is serious chelation to get rid of the iron, because if you don't, it builds up in your organs, and that can kill you.
What's the recovery level for somebody who has MDS? Is there one? Or what's the survival level?
I don't know what the actual survival level is, because it's such a variable disease. You know, some people get it and they very quickly transform to acute myeloid leukemia. And acute myeloid leukemia, or AML, which develops from MDS, is harder to treat than regular. Then really the only thing would probably be a bone marrow transplant or stem cell transplant, which is more common now.
How common are they, these transplants?
That I don't know either.
Yeah.
Because you use them for all sorts of other diseases.
Sure.
You know, and
yeah.
like for aplastic anemia, not sure about multiple myeloma, but AML, which has just developed itself without being MDS first, they use transplants.
Yeah. Okay, so the meeting and this gathering is to disseminate information. Patient Education Day. It speaks for itself. This is going to be in Vancouver over the weekend. Can you tell us where? And is there a place people can take a look at, maybe on the internet, to get more information?
Yes, if you've got the internet, go to www.amac.ca, and on the left-hand side of the homepage, you'll see upcoming events. If you click on that and then scroll down, you'll get the information for the registration form and the agenda. Failing that, if you don't have the internet, you could just show up at the Sheraton Vancouver Airport Hotel on Saturday morning at 8:30 and register then.
Is there a cost of admission?
There's no cost of admission. And you can apply for certain costs related to getting there.
Okay. Well, thank you very much for coming in. I'm sorry it was so short. Nice job.
Thank you very much.
Pam Wishart is a board member of AMAC, Aplastic Anemia and Myelodysplasia Association of Canada. 4:46 and change.